Hi! Okay, so I totally forgot to do any more updates. I was really hoping that I would do at least one a week, but here I am, I think 5 days, 5 days away from being one whole month post-op, and I only did one update. So, here I am, finally realizing that I needed to do this. So, yeah, there's a lot of information to cover, and I'll try to make this not too crazy long of a video. Basically, at this point, I have my bandages all off. I've been able to do pretty much everything, almost. I mean, I still can't run, I can't exercise or do anything crazy, but, you know, I've been able to move around, I have my full range of motion, I'm not in pain, and I can get dressed and wear any kind of clothes, and I don't really have any of those limitations that I did initially after surgery. In my last video, at that time in my recovery, I was only able to wear sports bras, and I couldn't pull them over my head. I had to step into them and pull them up. I wouldn't really wear shirts. I was mostly just kind of rocking the sports bra because I was just, you know, at home. And yeah, now I've been able to, you know, put clothes on and go out and do stuff, and I'm kind of back to normal almost. I still have some sensitivity and, you know, a little bit of that kind of tenderness, soreness, whatever, that you get as you're healing from anything. You know, if you have a cut or a scrape or anything, I think there's that time where, you know, it's almost healed but not quite, and that's kind of where I am right now. My incisions are almost completely healed up. I have a few little spots where they're still kind of open. On this side, actually, I had a little mishap where I don't know if I did something, if I moved around too much, or if I slept wrong or something. I don't know if I did it or if it just happened, but I have a little opening, kind of like a little tear almost, where part of an incision is just kind of open. I don't know why. I really don't. I don't recall anything like that happening. But I found out, I guess a few days ago, actually. I was getting undressed and I was kind of rubbing and massaging my incisions because at this point I'm using scar treatment, and I'm kind of just trying to get everything to heal up and be as lump free as possible, because the scars they're pretty lumpy, but they really don't look that bad. They just feel kind of weird, and I want them to heal in the best way that they possibly can, obviously. So I've been doing the scar treatment and kind of rubbing the tissue so that it heals, and just for no reason at all, I kind of scratched at something, and a scab came off, which, you know, is kind of gross, but I thought, well, that's, you know, that happens with skin that's healing, you know, and if you have a scab, eventually it comes off. But underneath that was just kind of this little hole, this little tear, where part of the incision had just opened up a little bit. It's really small. I mean, you know, it's not anything that I'm super worried about. My mom's a nurse, and you know, she's been helping me keep it clean and bandaged and stuff. I think it'll probably be fine, but that's literally the worst complication that I've had. Other than that, like, everything has gone really well, and I'm very happy with everything, and I'm almost completely healed up with no problems, really. But yeah, that's kind of the worst of it. But overall, I think everything looks good, and I'm feeling good. For a while, I had some trouble with really, really bad sensitivity. Now, what I was told and what I had read about in my research was that a lot of people experience numbness or just no feeling at all. They lose feeling, like, in the nipple, and sometimes it comes back, and sometimes it just, you know, you never get it back. And I thought, well, that's kind of, you know, kind of weird, but I guess at the same time, you know, if you're going to be cut into, I guess if you're going to have some kind of complication, numbness is probably, you know, kind of convenient. At least you don't feel anything, you know, no pain. But on the other hand of that, I didn't really read any experiences on this, so I guess it's kind of more rare. But as I've been told since, on the other hand, people can have hypersensitivity, just the complete opposite. Instead of going numb, it's like pins and needles and tingliness and kind of pain, and just, it's just kind of like an annoying sort of feeling, almost like everything's just really raw and sensitive and tender. Like, it's so hard to explain. It's like almost kind of like carpet burn or anything that like makes your skin really raw and irritated. It's like that, only it's kind of inside. It's weird, but apparently that's just caused from nerve regrowth, because everything's kind of been severed, and it just sort of has to find its way back to normal, and in that process you can experience a lot of sensitivity or numbness for some people, but I got the sensitivity, lucky me. And that was really rough. I would say that was worse almost than the initial pain, like the first few days when I got home. That is just kind of like being really sore, you know, like when your muscles feel tired after exercising or something. That's how I would describe that pain. This, the sensitivity was more like sharp and like, ow, okay, I really want this to stop. And it took a while, and it's still sort of there. If I kind of rub up against something, it's definitely still pretty sensitive, but it's not as bad as it was. That was like, it was impossible to get comfortable. I just always felt like, you know, like something was touching me and something was rubbing up against me, and it was very irritating. That's the only way I can describe it. It's just a very annoying, irritating feeling. But luckily I'm getting better and better all the time, and so that's kind of going away, and for the most part I'm not in any pain. I stopped taking my prescribed pain medication like probably like 4 or 5 days after the surgery. From there on out I would only take one right before I would go to sleep, because sleeping it's hard to do for me if I can't toss and turn and sleep on my stomach. And obviously you can't do that when you have breast surgery. That's kind of like the #1 thing you shouldn't do, is lay on your stomach. So for me it was really hard to get comfortable and to sleep, and I kept wanting to lay on my side, and it would hurt to do that. So for some reason taking one of those pills, it just knocked me out. It made sleep a lot easier and more comfortable, and that way when I woke up I wasn't just like crazy sore. But I didn't take them during the day. They just made me way too tired, and I didn't really need them. And I can't even remember how long ago I stopped taking them at night. But basically, I've been fine. I've been pretty pain-free, and I've been able to go without the medication for a while. So I've definitely been feeling a lot better. And I will say it wasn't nearly as bad as I thought it would be. I know I'm still recovering, but that initial, like, first few weeks, I thought would be miserable. I thought I would just, I thought I would be a wreck, really. I thought, like, I might cry or just, regret doing it, and it definitely hasn't been that bad. I think I've done surprisingly well, and even my family have made comments, like, you're actually handling this really well. Like, this isn't as bad as I thought it'd be, and it really hasn't been, It's just kind of one of those things you just sort of have to be a trooper and just put up with it, It's more, like, frustrating than anything, just not being able to move around and do the things that you usually do, but it's not like it's excruciatingly painful or anything. It's just kind of, you're in some discomfort for a few weeks, and then, you get to live with the results forever. So it really hasn't been that bad, and I'm super happy with how everything's turned out. Obviously, as far as the way I look right now, it looks like I've had an operation. I have scars and everything. I'm still, like, a little swollen, and I don't really have the exact shape that I want, but I love the size. I love the way I'm feeling. It's just, it's awesome. It's almost kind of surreal. Like, at first, there was this weird feeling, especially when I first saw myself without bandages. I felt like, this isn't me. Like, this isn't my body. Like, I don't look like this. What's happening? Like, it was almost a little scary. I thought, just part of me, like the tiniest part of me, thought that I was disappointed, or that I, had done something wrong. Like, I looked in the mirror and I just felt weird. I was like, this isn't me, and I don't know how to feel about this. It was just kind of the shock of having such a huge change to my body, I think. But now I'm perfectly happy, and obviously I would do it again. I love the results, and I'm not even totally healed up. I still have a lot more to experience, and a lot more of the benefits, like being able to go swimsuit shopping, and buy clothes that I could never, wear or fit into before, and, there's so many great things about this whole thing. I can't think of a reason not to do it, I think even when I was, like, a little shocked at first, I couldn't think of a negative. I was looking in the mirror and I was like, this is so weird, I don't feel like myself, but I couldn't think of a reason why to be unhappy. I wasn't disappointed or anything. I just felt weird. But I think that's just, like, the newness of it all, and once that wears off, it's just kind of like, okay, this is fine, At this point, I'm kind of used to it, At first it was like, oh my god, I have really small boobs, what is this? And now I'm just like, okay, no big deal. I don't even think about it anymore, It's not like something that just is constantly on my mind like it was the first few weeks. I just feel kind of normal, and like how I should be and should have been, and yeah, it's really great. I would say, just as a piece of advice, is just don't focus too much on how you're gonna feel immediately after. I kept expecting just this magical transformation, like I would wake up from surgery and just, you know, look at myself and go, wow, you know, and that I would sit up for the first time and automatically, you know, be able to sit up straighter and feel like this weight off of me. And that's just not how it works. It takes a little while for everything to kick in and for you to feel normal and actually realize how much, you know, of a positive change this is. You know, at first you're kind of just in shock. It just seems like, ugh, like what did I do to myself? But then, you know, then it's great. But yeah, I expected, I think, one of my biggest misconceptions was that I would sit up for the first time and just feel lighter and be able to sit up straight all of a sudden. And that's definitely not the case. Even now, almost a month later, I'm still struggling with my posture. I can't comfortably sit up straight for long periods of time. Obviously I can now, you know, if I want to, I can do it. I'm not like disabled, but it's still hard to maintain that because just the muscles in my core and in my back are so underused, you know. For so many years I just slumped. That's all I really could do just because of that weight. I had no choice. That was the only way that I could be comfortable, is if I was slumping. Now I don't have to slump anymore, but it's still kind of hard not to. I thought it would just be this, you know, instantaneous change, like, you know, oh, just, yeah, everything's better now. But it takes a while, I think, to work on improving that aspect of it. I think you kind of have to strengthen your back a little bit, and I'm still working on that, you know. I'm still trying to sit up straight, and it's still hard, you know. It still kind of hurts and feels uncomfortable, and it's different. It's definitely different because there's not this weight pulling. I don't feel the pulling and that just sensation like, oh my gosh, you know, I have something on my shoulders, you know. You do feel a weight off of your shoulders, but it doesn't make it any easier to hold them up, basically, is how that works. So that's something I would say just to people who are considering this, or, you know, planning on doing this soon or whatever, is just don't get too caught up in how you're going to feel immediately after. Just focus on resting, being comfortable, you know, making sure you're healing well, you know, that everything's clean and that your incisions are healing up well, and just all of those little things that go along with surgery, and then everything else will kind of just fall into place, and you'll start feeling more comfortable and just happy about everything. But it takes a while to, I think, to realize the full extent of how much you've changed and how far you've come. But yeah, it's definitely been a great experience, and I would do it again, even though it was difficult. But yeah, I'm really happy with everything, and I just kind of feel more comfortable and more myself. Like, this is how I am supposed to look, you know. Very happy with everything, and I will give you a quick look at my incisions just because I got a request to see the scars. They're actually really not as bad as I thought they would be. I was kind of expecting these huge, like, gashes, and it's really just like a very thin little line, you know. It's kind of red, it's sort of irritated, it's not like the prettiest looking thing in the world, but overall it's a lot better than I expected. And obviously I can't show you my whole boob, but I'll show you what the underneath looks like, just because that's the only thing I can really do while being appropriate, for YouTube at least. So this is what the underneath looks like. And you can see it's a pretty thin line, you know. in some places where it's really almost healed up, you know, if it weren't red, you really wouldn't be able to see it. There's a little irritated spot right there, you know, where the two incisions meet. There's the one going vertical, and then this is the one underneath. It goes almost all the way to my armpit. That's why it hurts to sleep on your side, is because the incision comes like all the way back like that. But yeah, so that's basically what it looks like. It's just underneath, oops, underneath, straight up, and then around the nipple. And yeah, since I've had the bandages off, everything has been pretty good. It looks a little weird. That's another thing, is it's a little shocking to see at first. It's kind of gross, but definitely not as bad as I thought it would be. I was so ready to just be like disgusted, and it's really not. It's not that bad, but just, you know, be patient and be willing to, you know, see the change, because as the incisions heal and the swelling goes down and everything, it's like you look normal. It's obviously you're not going to look perfect right after surgery. I think everyone kind of hopes that they will, but that's just not how it works. But yeah, just if you have any questions, or if there's anything that I forgot to mention or whatever, I will be happy to respond as soon as I see your comment or question or whatever, and hopefully I will do another update maybe like after my next appointment, so that way I'll be like totally healed up and I can give you a full post-op review. And yeah, and I guess also I'll show you, just while I'm at it, what I look like now as far as my size. I think it's very adequate. I think it fits my body, and yeah, I just feel really good. So anyway, I will see you in my next video, and hopefully this has been helpful to you. And leave a comment or a question and I'll get back to you soon.